Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner. Hope everyone out there in the universe are having a marvelous Tuesday. And for those of you who are celebrating Halloween, please do it safely because unfortunately, too many instances happen of people having some issue or that, regarding unsafe candy or traffic situation or something related to Halloween. But most of all, have an amazing, amazing time. Here in Northeast Florida, I don't know where you are tonight, but in Northeast Florida, today it was an awesome weather day. Wouldn't you say so, Dr. Kane?
I sure would, and I'm gonna like tomorrow even better because it's gonna be cooler.
No, sir. No, sir.
I love the cold weather.
80 degrees is my favorite weather, and then when it gets down to the upper 60s at night, perfect. But enough about me. So tonight we're talking about my favorite subject that I just can't seem to grasp. But guess what, Dr. Kane? I have to grasp it because I am turning the ripe old age of 65 in January. And so I've got to now make a decision about Medicare. So tonight we have two experts in the field. Well, they may not consider themselves experts, but I'm going to say that they're experts
I consider them experts.
to help us and those of our listeners, our viewers, understand what Medicare is and more importantly, how to choose a plan. Because, and by the way, Mr. Alexis, thank you so much for sending us that information that you did because it actually helps me. Because I don't know how many conversations Dr. Kane and others have had with me. I don't know why, Mr. Carter, Alexis, I just can't get it.
Yes.
But you're going to help me out. And welcome to the podcast tonight. How are you doing today?
I'm doing excellent, Ms. Turner. Thank you so much for having me this evening. Dr. Kane, thank you so much for having me. All the viewers and listeners out there, thanks for tuning in. I'm very excited as we're in the midst of the annual enrollment period to be discussing, Medicare insurance.
Awesome, awesome. Well, we look forward to a lively discussion and hope our viewers will chime in. Also joining us this evening, as he has on the screen, insured by Earl, but I like calling him his good government name, Earl Jones Jr. How you doing this evening, Earl?
I'm good, Jocelyn. How about you?
Oh, doing good. Listen, I age myself, and Earl is used to it, so he's okay. When he graduated from college, he was actually before he graduated, he was my intern. So that was just 5 years ago, by the way, because I'm not that old, although you're seeing a fully grown man here, right?
Right.
But anyway, welcome, Earl. How are you doing? Are you doing okay today?
I'm doing pretty good. Doing pretty good. Happy to be here. Thank you for inviting me on the show.
Absolutely. So I want to first be personal, right? And either of you can answer it, but you don't have to answer it as though it's just me. But I know I'm not the only one. Why do you think people are confused about making a selection of their Medicare plan? And either of you can answer. Why do you think? Because I am so confused about it.
I guess, Alexa, if you don't mind me jumping in first on that one.
Yes, sir.
What I would say, what I think is the reason is there's a lot of options. A lot of people are turning 65 and they may be losing their employer coverage. And a lot of them may not have known everything about their employer coverage before they left. So they're jumping into a whole new territory, trying to figure out, with all these different companies sending them, mail, emails and stuff like they're seeing these commercials, they're telling them you can get this food card for free and this and that, and they hear about Medicare supplements and all these things. I think it can become overwhelming, and that's what I think. I think from what I've my experience over the years, I think people kind of they throw a lot at you, especially when you're turning 65, because they know they have lists that when people turn 65, they some companies can access that information and census data and know that you're turning 65, and then hit you with a whole lot of mail. So I think it can get confusing in that regard. But that's my 2 cents on it.
Thank you, Earl.
Yeah, I definitely agree wholeheartedly with Earl about, the number of options out there. I also think, sometimes consumers don't realize that there's a lot of help, and it's okay to find maybe a trusted insurance broker within their community, or, a circle of friends that might know a trusted insurance broker that can help them in making their decision. And the reason I say insurance broker versus agent, that broker ideally will be appointed to offer multiple carriers and be able to, look at the providers, the medications that consumer is taking, and then based on that consumer's desire on how they would like to outline their health plan, they can get the necessary help. So if they know to look for brokers out there that they can trust, it'll help mitigate the confusion.
And by the way, but wait a minute, Dr. Kane, I just have to slide in one funny thing that Earl, when he was talking about all the emails and things you get, also, Earl, I've gotten more offers for free dinner from these managed care plans trying to entice me to buy their plan. Go ahead, Dr. Kane.
Yeah, I was going to chime in. I think that's one of the reasons there's a lot of confusion and stuff out there. One of the things is that they're offering a lot of incentives to join their plan. Now, those incentives are not necessarily the best thing for the individual, okay? Whether or not it's because they offer some exercise program, and no particular insurance company am I looking at, but like a Silver Sneakers or some gym membership and so on and so on. They offer those things for free. And when people hear free, sometimes they're in a hurry to go and jump on board and grab the free the free prizes that they give for joining their plan, not realizing that there's multiple things that could be wrong with that particular plan in terms of not fitting their needs. Whether or not it's because of the amount of coverage, and when I say the amount of coverage, the geographical versus, do they have enough specialists? Do they have the things that individuals need? So I like to make sure that my patients, when they ask me, I like to make sure that they understand that there are a lot of things out there, gimmicks out there to draw them into a plan, and that they need to see what best fit them. One other thing that both of our guests I enjoy, and I really like them for being here, is that they are brokers. They are independent brokers. They're not obligated to sell a particular type of insurance for their own self-gratification in terms of, if you work for one insurance company and someone asks you for Medicare advice, they may give you everything about that insurance company that maybe that still might not be your fit. It may fit you, but it may not fit you. So an independent, I wanted to stress that fact. That's what I'm really trying to get to. An independent broker is one of the best things that you can grab. And that's one of the reasons we got both these gentlemen on the show.
That's right, Dr. Kane. And I'd like to start out, I don't like making an assumption, by the way. So what is Medicare, and why is it, or how is it so different than the insurance plan I currently have as a 64-year-old person? And either of you can jump in.
If you don't mind, Earl, I can answer that. Medicare is an entitlement program. So essentially you paid for it and it's owed to you. You pay for it typically in your taxes, the Medicare taxes, the little chunk they take out, so you pay for it in advance for many, many years. And that entitlement program is designed for people that are 65 and older. Now, if you are not 65 yet, but have some type of a disability for 24 consecutive months, you'd be eligible for Medicare. Or if you have some type of ESRD, end-stage renal disease, you'd be eligible for Medicare as well.
Yeah,
So it's a program.
there's certain chronic diseases that would allow you to be eligible for Medicare before you're the age of 65.
I never knew that. I wish I had known that, Dr. Kane, when my dad had, because he didn't have Medicare, but he had, anyway, I digress because my dad is gone on. I don't want to rehash that. But thank you, because so what about someone who's working? If I'm working and I currently have health insurance by my employer, do I have to choose Medicare?
I can answer that one. So the short answer is no. If they offer what we consider credible coverage, you can stay on that employer plan until you're ready to enroll in Medicare. So you can, essentially, you could, save yourself time, without the penalty, because, some people, if they're not employed, they decide, well, I can enroll in Medicare later. I don't want to pay that Part B. They get assessed the penalty. But as long as you're employed, you won't be assessed that penalty if this credible, what we consider credible coverage.
Yes.
And what's incredible? Not incredible. I'm sorry. What's credible?
It's the level which Center for Medicare determined that is enough coverage that would provide, I believe, correct me if I'm wrong, Alexis, I think at least 60% of your healthcare coverage. And that percentage may be a little off more or less, but it's what we, basically enough coverage to cover, anything that life throws at you, where you can, go see your doctor, or if you need surgery or stuff like that. They call it credible.
Yeah, absolutely. Like that minimum essential coverage that would be necessary. And some examples of that could be, like you said, Mr. Earl, is that employer coverage. There's also other types of, credible coverages out there, like some of those individuals that might have TRICARE. That's considered a credible coverage as well, where they wouldn't need to make a quick enrollment.
So I know Medicare has 4 different parts.
Yes.
Before you get to the different parts, JT, let me ask. There are there's a timeline in which you must enroll in Medicare. Can either one of you guys just make sure our audience knows when they must enroll and not be considered late? Because being late, you may get a penalty that may be lifelong. So can anybody explain that for us?
Sure. I'll go ahead and explain that. So when you are approaching, for example, your 65th birthday, or Part A typically will, 3 or 4 months before, they will send you the request for that. And you have a choice now also to enroll into Part B, because the Part B, has a premium. In 2024, it's going to be $174.40. The Part A typically will come automatically, assuming that you or your spouse has worked the 40 qualifying quarters and paid Medicare taxes. So essentially 10 years and paying Medicare taxes, right? So that will come essentially automatic, and then you can choose to enroll into Medicare Part B. Now that enrollment, there's a 7-month window into for that Part B. So you have the 3 months before the month of you turning 65. You have the month of, and then you have up to 3 months after. So that's the 7-month window. So if we look at a calendar for an easy example, let's take the month of April. Let's just say you're turning 65 next April, folks. that means as early as January 1st, you can start requesting or making your request for, part B, essentially, right? Then you have February, you have March, and that is to have your Part B come into effect April. If you wait the month that you turn 65, which is April, then that Part B would then come into effect, excuse me, May 1st. And if you wait till May, June, and if you wait till June, July, based on that 7-month window, so you have January, February, March, then you have April, which is 4 months, and then you have May, June, July. So July 31st would be the last day that you can enroll in Part B using what they call your Medicare IEP.
And not be penalized.
I'm sorry. Yeah, to not be penalized. Right. Now, if for some example, like you choose to delay it because of employer coverage, you have credible coverage, you don't want to double pay for insurance, that's fine. That will save you from the penalty. Because if you go without Medicare Part B for a total of 12 consecutive months, you're going to be assessed a 10% penalty, right? So it has to be 12 full months. If you go in just 9 months after, there's no penalty. If you go in 18 months, then you have a 10% penalty. If you go 24 months, it's a 20% penalty. So it's 10% for each of the full 12 months that you do not have credible coverage. You'll be assessed what is called B penalty, which is that 10% for every 12 full months that you're not on.
So I'll be 64 in January, 65. Oh, wishful thinking, 65 in January. So now, of course, I'm getting bombarded, right? Yes. So now when you say we should enroll, how do I enroll? Do I need to call 1-800-Medicare or how do I enroll?
Okay, I'll take that. You can get with the your local Social Security office here in Jacksonville. You could do it online. You can set an appointment if you want to do it in person. Some people rather do it in person. They may not be wanting to use their computer and set it up online, but you can access it online. And the website is Alexis, help me out here. What's the website? It's
for online.
Yeah,
they could do it off
SSA.
SSA.gov.
Yeah, SSA.gov. They can go online and go ahead and get their enrollment started. That's probably the easiest way if they have a computer at home or a smartphone. The lines can be long at the Social Security office. I understand that if you do not go at right when they open those doors, you could be sitting there for hours.
Yeah.
And I just, want to make sure people are listening, because some people try to go up there 2 o'clock in the afternoon or 1 lunchtime, and, the line's pretty long.
So when you talk, Cardi, I hope you don't mind me calling you Cardi.
That's the name.
When you mention Part A, now that's the hospital coverage. So let's just say if I have credible insurance with my employer and I still sign up for Medicare and I unfortunately am hospitalized, does that mean if my credible insurance does not cover all of my hospitalization, my Medicare Part A will kick in because it is hospital insurance?
Yeah. Kick in if you are on what they call original Medicare. I don't know, depending on your health plan, I don't know if it will essentially coordinate. You may have to use one or the other in that instance. But yeah, you'd have at least that Part A coverage. Yes. And, just to add a little tidbit, Ms. Jocelyn, a lot of people are essentially double paying, right? So like they have employer coverage through their employer, but then they decided they enrolled also in Medicare Part B. So essentially you're looking at it, it's almost like one has to, it doesn't have to go, but if you really look at the benefits and dive deep, you could save some money by making a decision. So that's why it's good to have a local broker that can kind of really deep dive with you to help you in making those decisions.
Thank you. If you're just tuning in, we're talking about Medicare. And if you notice, I am personalizing it a lot because, yes, I will be 65 in January. If you have any questions of our independent brokers, dial in now, 888-669-1280. Again, 888-669-1280, or you can post a question. Dr. Kane, you look like you're just busting at the seam to ask a
I was
question.
gonna say now is the time that we can differentiate between Medicare Part A, B, C, D that people hear about all the time. So whomever wants to take that on and explain the different parts of Medicare.
Can I do it a little different? Because
Okay.
here's the part that I want the difference, the distinction between why Medicare Part C. Why do these Medicare Advantage plan? What's the difference between that and some other kind of Medicare? And is there a difference? And I associate it with, when you had an HMO versus a PPO. Does that make sense?
I understand, but that's why I was going to go through at least the basics of A, B, C, and D, which one with those at Medicare, and then get more detail like what you're asking right now.
Hit it.
All right, I'll kick it in real quick in short to answer both questions, right? And then after that, Earl, if you want to, after I go, I'll throw in the quick parts, and then if you want to do the like Medicare Advantage versus Medicare Supplement, you're more than welcome to. But when you have, like you said, Medicare, there's essentially five main parts, right? You have Medicare Part A, like you mentioned, Ms. Jocelyn, which covers the hospitalization, right? So the hospital has to get paid somewhere. Part B is your doctors and outpatient services. So whenever you are dealing with any type of medical issue, the facility has to get paid if it's in the hospital, and then the doctor has to get paid as well. And then I'm going to skip. So that's Part A, which is hospital. Part B is your doctor. I'm going to skip over Part C and go into Part D first. Part D is basically prescription drug plans, which started in 2006. So that's, very, very important. And you have to have prescription drug coverage or else you get penalized, even if you're not taking prescriptions. Now, to go back to Part C, imagine if you take Part A, Part B, and then oftentimes, not every time, but oftentimes Part D, and you take all those little pieces and you throw it into a blender, right? And then you let it blend up, you shake it up, you make it nice and mixed. And then you get what is called Part C, which is your Medicare Advantage plans. So it has all of the components of Medicare Part A, Part B, and many times Part D kind of mixed into its own flair and structured into Medicare Advantage, commonly known as Part C. And that can come in different formats, such as PPO plans, also HMO plans as well. And then they do have what they call special needs plans that we could always dive into if you really want. Other than that, I can pass it back to Earl to kind of give a comparison between some of the different Medicare health plans out there.
And before you do that, Earl, just real quick, Part A is automatic. You don't have to really sign up for that one, right?
But I thought you said you have to enroll. But I thought you said you had to enroll. So what do you mean it's automatic?
Well, if you work for 10 years in your life in the U.S., generally you've
paid into
eligible for Part A, where you do not pay. Everybody pays a Part B, unfortunately. But Part A, it comes pretty much automatic. If you just moved to this country 3 months ago, no, you're probably going to have to pay for Part A. If that makes sense. So as far as Medicare Advantage plans do offer extra benefits, such as has Doctor mentioned like Silver Sneakers, which offers free gym memberships at a bunch of local gyms around for people that want to get out and get moving and stuff like that. Routine dental, for example, or with vision, hearing. Some of them, depending on the plan. Now they're all not going to have routine dental, vision, hearing. Most of them do have Silver Sneakers. Not all of them have transportation. Some people may need transportation, where a lot of Medicare Advantage plans offer free, unlimited rides to and from your doctor's office. Sometimes people may ask questions about our Medicare supplement plans, which I think we consider Part E. It's a supplement. We also call it Medigap. It's different from a Medicare Advantage plan. It is extra coverage you can buy. It comes with a premium. So this type of coverage, you do have to pay a premium, unlike a lot of Medicare Advantage plans that have a $0 premium. The supplements help you pay for any out-of-pocket expenses that you may incur with original Medicare.
Thank you. So if you're just tuning in, we're talking about Medicare. And from what I gather thus far, because I am taking notes, I have my little cheat sheet here, even though I'm going to get with one of these guys afterwards. But as they mentioned so far, who's eligible for Medicare? People age 65 and older, and some younger folks with disabilities. And what I learned tonight that I didn't know, and that's Dr. Kane. That's why I love when we have these guests, because I always learn something, that if you had a chronic disease like end-stage renal disease, that also can qualify you for it. Again, if you have any questions, give us a call, 888-669-1280, 888-669-1280. I'd also like to ask our behind the scenes guy, who is usually very busy, Tyrone, do we have a history maker moment for this evening? Yes, we do.
And advise our guys what history making moment
I was just about to say that a few weeks ago. It's been about a couple of months ago now. If you live in Florida, then you know that talking about African American history, it was removed from our school system. So we decided, well, guess what? We're going to celebrate those African American history makers. And so each week we featured a notable person, and Tyrone has done a great job enlightening us. Take it away, Tyrone, and we'll get back to our topic.
23, 1924. Dr. George Simpkins Jr. was a dentist, community leader in Greensboro, North Carolina, and civil rights activist. During the 1950s, he won several significant desegregation lawsuits and was, for a quarter of a century, the president of the Greensboro branch of the National Association for the Advancement of Colored People. Beginning in 1955, Simpkins used the courts and local referendums to compel the desegregation of recreational facilities, schools, and hospitals and end discrimination in the delivery of public housing, banking services, and city services. It started in 1940, when the city of Greensboro constructed a golf course using public funds, 65% of which were provided by the federal government. The course was opened in 1949 by the city of Greensboro as a public facility exclusively for whites. In 1955, Simpkins decided to challenge the city council's segregation rule by going to the Gillespie Park course to play. On December 7, 1955, the same week the Montgomery bus boycott was launched in the wake of Rosa Parks' defiance of bus segregation. He and 5 others went to the Gillespie Park course, where they presented green fees, but were not given permission to play. They were told the Gillespie Park golf course was a private course for members only. Simpkins placed 75 cents, the green fee for the course, on the counter and proceeded to the course after insisting on his right to play. The manager approached Dr. Simpkins and his 5 companions and demanded they leave, but they refused and continued to play. Simpkins and the 5 other players were arrested and charged with trespassing. All 6 men were convicted of simple trespass and fined $15 and court costs. In an appeal to the state Supreme Court, Judge Johnson J. Hayes ruled that the plaintiffs were unlawfully denied access to use Gillespie Park, and this was done solely due to the color and race of plaintiffs, and said he intended to open the golf course to all citizens. Simpkins went on to challenge segregation with other legal trials. Simpkins versus Moses H. Cone Memorial Hospital, boycott and picketing Wachovia Bank for on-the-job training and equal employment.
You know, let me add to that what I do know. I want to make sure people understand. You know, that Greensboro is the home of North Carolina A&T, and you know, and HBCU, as everyone knows. Back then, we had a problem just integrating hospitals, and the National Medical Association was instrumental in Black physicians and doctors like Dr. Simpkins, even though he's a dentist and still was Black professionals, a dentist. They were instrumental in making sure that Medicare, in helping Medicare integrate hospitals. Because if these hospitals, if they wanted that Medicare money, which all of them did, if they wanted that Medicare monies, they had to allow Black physicians, like Black patients, to be able to enter into those hospitals. If they could not, those physicians, all they had to do was report them. They were kind of like G-men, you know, government men back in that time. If they did not, they reported that hospital, that institution to the federal government, and they went in and said, if you don't let Black folks in, you will not be getting Medicare dollars. Of course, money spoke higher than anything else, and they were forced to integrate. So kudos to Dr. Simpkins, and for those that that did not know who he was, and it was no rivalry, but with the attention that was given to Rosa Parks, people like him and others didn't get that national attention, but they were just as influential, and their actions were just as incremental in terms of making sure that African Americans were able to go wherever they needed to go to see care. In this case, we're talking about medical care, but also sit at the counter and all the other stuff that we needed.
You know, Dr. Kane, there's a lot that we take for granted nowadays, right? You know, the ability to not know it. We know that we may choose you, for example, as a primary care physician, but if any of your patients goes into the hospital, then obviously you'd want some feedback on how they're doing, and, you know, at least have somebody from your circle to
Right.
go in and check on them, right? And again, that's something that you all had to fight for the right. So kudos to you. So I want to get back to Medicare Part A, for example, because I know when my dad got sick, for example, he went in the hospital. He had end-stage renal disease, I might add, and getting out of the hospital, he needed some extra care. I want to talk a little bit about, when you talk about, I know you said hospitalization, but does Medicare Part A cover if you have to go into a rehab center, for example, you know, for a short stay versus a long-term care facility? Go ahead.
Would you like me to?
Sure.
Yeah. All right. So, yeah, with Medicare Part A, it also covers, on top of the hospitalization, it covers skilled nursing care to an extent. You know, with skilled nursing care, it's not designed to be long-term care. So Medicare is not here to pay for someone for many, many years to be taken care of in a skilled nursing facility. But if you do get put in the hospital as an inpatient a few nights, and then you come out, as long as your doctor has what is called a written plan of care, and you go to a Medicare approved skilled nursing facility, then there is some coverage, right? Typically, your first 20 days will come at no cost in that skilled nursing facility. And then after 20 days, there will be a copay per day. So what you'll notice is a lot of times in these skilled nursing facilities, they will typically try to get the consumer out before those 20 days are up, because they know, when you get into the copays of $100+ a day, it becomes very hard for consumers to afford. So yeah, it does give some limited skilled nursing coverage if you were hospitalized as an inpatient.
The only question I have with that is because of some experience and some of my patients.
Yes, sir.
For whatever reason, I thought 60 days were what some of those, and it may change since I last. I thought 60 days might have been the time period. By the end of 60 days, Medicare say, okay, we're no longer paying for that, the nursing home. I'm gonna use nursing home. We're no longer paying for those nursing homes of those rehab facilities beyond 60 days, and then Medicaid kick in. And that's not my area of expertise. I just know what I've dealt with some of these patients and what happened. Is that has that changed from 60 to down to 20, or was it always 20? And then that was some default extension because of Medicaid, or exactly how did that work?
So that is it's 20 days. So from day 1 through 20, $0 cost share for that consumer. Day 21, I believe, through like 100 is where there is a specific a co-payment per day. I don't have that exact number in terms of the co-payment, but
Okay.
I know from there at 100 days is where it caps. So anything beyond 100 days is full cost out of pocket.
Right. Okay.
I think sometimes the 60 days might come from the Part A, right? So
Yeah.
Part A is once you have completed that Part A deductible, assuming that you're on original Medicare, it's technically a 60-day deductible, essentially.
Is there any other Medicare plan that you can enroll in to pick up after 20 days? Or is that strictly out of pocket?
It would be out of pocket unless the person has any other type of, long-term care or type of policy that can start kicking in to help.
To kick in and help pay for those expenses.
Yes,
That's
ma'am.
when it seems to me, both of you, just a comment, that's when families then are struggling to figure out how to keep their loved one in the hospital or to bring them home. And so, I know this is kind of a sidebar, but since you mentioned it, Cardi, that's people should really keep and include or add, if they can afford it, a long-term care policy to help them with unfortunate situations like that, wouldn't you say?
Yes, definitely.
Yeah. And do you advise that when people are younger, or if they are aging, and or if they have some type of medical issue or chronic health condition, like right now, if someone comes to you, at what point do you typically encourage people to get a long-term care plan? Any particular age?
In my experience, the younger the better. Just because the younger and healthier you are, the lower your rates are going to become. But as you start to age, long-term care can get extremely, extremely expensive. There are some other routes that we've seen that consumers have received long-term care. Like you could get it through Medicaid, right? But the downside of that is you potentially have to drain your assets, and they have a 5-year look back. So it's not like you can just drain your assets right away and they're going to just take you. So that part of getting it through Medicaid is a little bit more steps to it. So that's why if one can, get it, while you're young, it'll help out quite a bit.
And let me add this part real quick. And even though it's not necessarily with our experts we have here, that's why when you start doing estate planning, remember, Ms. Turner, we've done shows on estate planning. You do your estate planning, you go to an attorney, and you can mitigate some of those circumstances by which your where I'm looking for, your estate is responsible solely for all the costs associated with your medical care. You know, what people don't realize is that you're also paying with your tax dollars, you're paying a lot of money as far as Medicaid is concerned. And so to keep people from going completely broke and to keep people that, and also so that you don't spend up all of your funds strictly on medical care, you know, you need excellent estate planning to help you and your heirs to conserve as much as your financial status as you can. So I'm just throwing it out for people to start looking at estate planning. That's one of the real benefits.
Sounds like a show we need to have again,
Exactly.
Dr. Kane. Go ahead, Carter. You wanted to say something?
Yeah, just a quick tad bit, just because I had a personal experience with my father. He was an immigrant, so by the time he got here, he long-term care was too expensive for him. He ended up getting dementia, ultimately passing away. But what I did learn in that experience is typically there's these offices called Area for Aging, and they work with not only Medicaid but all the different local resources. So my father didn't qualify for Medicaid long-term care, but we were able to tap into certain local resources. So Collier County had funds that would provide respite care up to 31 hours a week for my father, to kind of help support my mom's help. And then they also gave food, diapers, and other resources that we needed at no cost to us. So, Area for Aging, if, it's too late for you in terms of long-term care, reach out to them, and then they can probably find any type of potential resources based on what you're dealing with. It's not a guarantee, but it's a help.
That is
And
an excellent
also area
that is an
agency.
excellent choice for future show topics. Is what
Area agency for aging or elder source here in Northeast Florida. Earl, you're not off the hook, by the way. So let me bring you in. So some folk have, when you talk about Part B, and I'm not sure if it's the right part, so enlighten me. But for folks who's on oxygen or a CPAP machine, any other durable medical equipment, which of the plans will cover those, or are those out-of-pocket expenses? Earl, you're on mute.
Okay. Some devices are covered under your Part B coverage and or Part A. A lot of people like the ones that do typically lean towards Medicare Advantage plans because sometimes there's extra benefits such as, devices, knee braces, different ways of support that Advantage plans offer that original Medicare may not cover. You mentioned oxygen.
Mm-hmm.
Okay,
Yes.
I think oxygen should be covered. If that's generally when someone needs oxygen, there's probably an underlying chronic condition there. So generally, those type of things would be covered.
How about a CPAP machine?
A CPAP. That's a good question. A CPAP machine. I might have to look into that because I don't want to tell you, yeah, that's covered, and then find out that's CPAPs ain't covered. For sleep apnea, I would assume that that's possible that that'll be covered. But again, I have to double check because I don't want to give you misinformation on here tonight. Alexis, would you know if this about CPAPs?
Yeah, typically they would be covered if it's deemed medically necessary.
Right.
Oh, okay.
Yeah, so it just depends, like how the doctor because the doctor in those processes kind of are helping you along the way in working with the different distributors for that durable medical equipment.
You know what you said? That really, Cardi, that really grinds my gears, as my niece would say. If it's medically necessary, and sometimes that's a non-medical person who tries to make that decision for you, and then the doctors have to add extra, or their staff have to add extra time to determine whether or not to help you really, be the go-between between you and your insurance company. Right in that. So, Dr. Kane, haven't you had to add extra time with you or your staff trying to make something medically necessary for someone to avoid
Oh,
out of pocket?
listen, that's what make doctors go broke because we have to sit back. We have to sit back and spend all this extra time, which, as people say, time is money.
Yeah.
Spend all this extra time trying to get these things approved. What people don't realize and patients don't realize is the behind the scenes that we have to do to get some of these things done. And as it relates to CPAP machines, if I said it's medically necessary, you might as well just go on ahead and buy a postage stamp and eat it because they don't care about what I have to say as a primary care. But the specialist, the pulmonologist, is the one in terms of this CPAP machine, and there's some other situations with other individual specialties. They can say it, and it's the gospel. And so, as a primary care physician, that's why you have to be very careful when you choose your primary care physician, when you choose when you choose your insurance, who's in your medical network. Okay, and these gentlemen will probably allude to that later. But who is in your medical network with that insurance plan? That's why you must be careful with who you choose because you want someone who will go to bat for what your needs are. Some people, if it's going to cost them employee time, which means they're saying that it costs them money, i.e. the primary care, cost them money is because they're using their employees to devote time to take care of some special circumstances that you need that is not going to add any benefit to my office in terms of extra monies, but because it's the right thing to do. Okay, it is the necessary thing needed for that individual, and maybe not necessarily in that order, but it's that right thing to do and the necessary needs for that as it relates to the necessary needs for that individual. You want to make sure you got that person, that physician office on board that will go to bat for you, whether it's the primary care or the specialist.
So I want to thank you, Dr. Kane. I want to ask a couple of very important questions, right? And one is, how do I choose between original Medicare and Medicare Advantage? What's the process for that? And is there a premium or deductible? Or I need some help, guys. I'm sorry, I'm still confused. So I'll start with the first question. How do I choose between original Medicare and Medicare Advantage?
I guess Alexis, I'll take that one. So once you enroll in Part A and B, you're now in original Medicare, right? With original Medicare, if you want prescription coverage, and you'll need to enroll in a Part D plan. Or you can decide if you want to get a Medicare Advantage plan, you can enroll. Basically, you'd contact me or Alexis, or an agent a broker in your area, and they can help guide you through enrolling in a Medicare Advantage plan. They're going to look at the area that you live in, because not all plans are available in every city. So they're going to want to look at, what's available where you're at, and what particular carrier, again, like, mentioned earlier, brokers, we tend to be not particular on any carrier because we don't work directly with those carriers. We're independent. So we're not going to try to steer you to a Florida Blue plan when, there's 5 other better plans out here next to it. And I'm nothing to say about Florida Blue. That's just an example. We look at, things, if there's any special needs, chronic conditions, diabetes, heart disease, cancer and stuff like that. There's specific plans for those type of conditions. Generally, Medicare Advantage plans, they offer a no-cost monthly premium. With original Medicare, there's a no-cost monthly premium. Again, if we're on an Advantage plan, you're still paying your Part B. Everybody's going to be paying their Part B. There's really no way around that. There's people that may fall below the poverty level that they can apply for, subsidies that help with, certain things that, prescriptions and things like that. But There's a lot of plans out there. A broker would probably be the best one to chat with, and they'll help you kind of steer you in the right direction. And their job is to show you a bunch of plans, and you look at them and you pick what you like the best.
You know what you just said, and Cardi, you might be able to clear this up for me, or Earl, you can chime in. What Earl just said is probably why I get confused, because he said if I have Part C, which is a Medicare Advantage plan, I'm still going to have Part B, right? So Part C is really just rolling up A and D and adding some fluff and making it C. Right? It doesn't include B. It doesn't include B. Did I get that right?
No, I wouldn't put it that way. I would say it was close. I would say the best way to put it is you will have Medicare Part A, you will have Medicare Part B, but you gain Part C in that, so you still have to have your Part A and B in effect to be eligible for a Medicare Advantage plan,
Okay.
Now, I wanted to just add a little tidbit to what Mr. Earl said. There are very few instances, when you look at Medicare as a whole, there's only 2% that decide to actually stay on original Medicare. There are very few instances that you want to stay on that original Medicare. 29% of eligibles out there are choosing Medicare Advantage, and 25% of eligibles out there are choosing Medicare supplement plans. You don't want to stay on original Medicare because obviously you have like a $1,600 Part A deductible, but Part B, you're responsible for 20% of Medicare approved charges. So that 20%, if you go to a doctor, it's $100, you're paying $20. But if you have to go through $100,000 surgery, right? That's a $20,000 bill, and that's not a good place to be financially. So that's why it's important to call a local broker like Earl or myself, and then maybe we can look at maybe a Medigap policy or even a Medicare Advantage policy, because Medigaps fill the holes, right, in the cost share. And Medicare Advantage has an important feature called maximum out of pocket. So it's a financial limit in terms of literally money that's coming out of your pocket on a year to year. And there's a maximum to that. Anything above that is the responsibility of the insurance carrier that you're affiliated with. So that's the tad bit I wanted to include on top of what Mr. Earl had mentioned earlier.
And also one more thing, original Medicare does not have a maximum out-of-pocket limit. And a lot of people don't know.
I could be paying forever. Paying the IRS.
Here's what I say to my patients when I try to compare them to compare these guys, these plans. When I say these guys, I mean these plans. Medicare, original Medicare is just like having to a certain degree, it's just like having insurance from your employer. 80-20. A lot of them give you that 80-20 plan to where your employer will pay that 80% and you're responsible for that 20%. There's a few of them that may say, or there's some of them that may say, well, once you get up to a certain amount, we will kick in and take over the rest or lower that 20% that you owe. But original Medicare is saying they're not saying they're going to kick in and pay any of that 20%. And you guys can correct me if I'm mistaken, if it's just original Medicare. Where some of these other plans come in, whether or not it's Medicare Advantage, that is, I don't want to say nullified, but is mitigated to quite a bit. But Medigap is the added insurance to cover that 20%. And there's an advantage to Medigap, and I don't want to overstate what the advantage is. There's advantages and disadvantages to it. And I think that's what a lot of our listeners would like to know, including yourself, Ms. Turner, because why would I go get a Medigap plan that would cover the other 20% and pretty much that's it, cover that 20%, when I can go on ahead and get a Medicare Advantage plan that would also cover that 20% and also allow me with a few other perks that may be out there. And my only thing, and I'm gonna ask these gentlemen to get a deeper dive into it. My only problem with that is there are some Medicare Advantage plans. Granted, they may cover a lot of stuff, but it may be geographically limited with what they're going to cover. They may also say you have to go to this particular institution or group of doctors. They may not include your doctor. That may not include your doctor, which includes primary care or specialists, and only theirs, okay? And so on and so on. There's certain limitations that come along with that Medicare Advantage. If you went with that Medicare Advantage just on the surface of what it says, hey, it's hands down, go ahead and take it because it's not as expensive. But because of those discrete circumstances that may exist with an individual, that Medicare Advantage plan may not meet your needs whatsoever, or reversed, because you're such a sickly individual with certain medical disease states, it will be perfect for you. That's why the benefit, I'm going to say it for these guys before they say it, that's why the benefit of an individual,
Independent
broker can help analyze your situation and determine what fits you best at that moment in time.
So, Cardi, you look like you want to say something, but Dr. Kane just sparked a thought. So answer this, please. And by the way, we may run a little bit over, but I wanted to make sure we just finalize a couple of more points. What Dr. Kane said he talked about the limitations that you may only be able to go to certain providers or within a certain area. So if you're a traveler, like some of my friends and I, if we like to travel out of state, out of country, I know we encourage people to get to buy insurance when you travel. However, if you are just someone who travels within the United States and you go out of state, does the Medicare Advantage plans cover you in those instances if you get sick?
Yes, they do, right? In certain circumstances, like a Medicare Advantage plan covers emergencies, nationwide at the appropriate emergency copays that's listed on the plan. Also, foreign travel is typically covered at a $50,000 lifetime benefit. Of course, if you are going to visit, let's say, Peru, and you go hiking, you get an injury, you can't give them your Medicare health plan card, right? You got to basically pay it, cash or with a credit card. And then upon coming back, you can file a claim for reimbursement for that foreign travel benefit. And then just to say something, Mr. K, the best way with Medicare supplements, Medicare Advantage, and I promise I'll stop talking. I'm just really so passionate about this stuff. Imagine with a Medicare supplement is like, imagine you go into like a mall or a massive buffet, right? You pay your $100, you pay in advance and you get access to all these different foods, right? You're paying in advance with a Medicare supplement, right? Versus a Medicare Advantage is like a la carte. You go to a restaurant, you pick a few items, but you only pay for what you need. So instead of paying advance, you pay for what you need with a Medicare Advantage plan. You pay for what you use, and with a Medicare supplement, you pay in advance in hopes that everything's going to be covered in the future. So, depending on what kind of outcome you want with your financials and how you're looking to allocate those financials towards your health care, a broker like myself or Mr. Earl can help you decipher the advantages and disadvantages, of each decision that you make.
And before, and Mr. Earl, you may want to address this, but either one of you guys can address it. I grasp it totally in terms of, your geographical location when you have those issues, along with, you get sick and, like you say, Peru, or it could be in Wisconsin, for as I'm concerned, My concern or what I question, out of network expenses versus in network expenses. And when you're sitting back and you're thinking about purchasing that plan, and it says it covers you anywhere in the geographical United States, including Hawaii and Alaska. Okay. But that coverage, while that statement is correct, that coverage may only be with out of network providers, which then can go, and correct me if I'm mistaken, which then can go to the moon in terms of the charges.
I would say it depends. If you're on a Medicare Advantage plan, obviously you're gonna need to want to stay in network, because generally they're in regions. The advantage that somebody with a supplement would have is that they can pretty much go anywhere in the U.S. With their supplement plan.
Same level of coverage, right? Is what
Same level of coverage, yes. Okay. And now the only difference is they're going to have a monthly premium with the supplement, but they will have fewer out of pocket costs. So there's no really one size fits all for people. When deciding which ones. That's why brokers can help kind of navigate. What do you like better here? Do you travel to California to see your kids every quarter? If that's the case, a supplement may be something you want. If you're spending a month over in, you're living in Florida, you're spending a month in California with your children or whatever state that may be, some Advantage plans won't let you just go, they may not have that plan out in that area. So that's something to be mindful of. Some people like supplements or Medigap for that reason. You don't need a network, you can kind of go anywhere with it. So I hope that answers your question.
It does. That's exactly why I wanted you, the independent guys, to come and advise patients that what's needed is someone to listen to your whole story, okay, and help you decide. They're not going to make the decision for you.
That sounds like a car dealer, Dr. Kane. That sounds like they're car dealers to me. They're not going to pick my car for me, but they're gonna help me figure out what car I need to buy.
Best advantage for you, yada yada yada.
Cardi, you look like you wanted to say something.
No, I was just laughing at the car dealer.
So I would, before we wrap up the show, I would like to talk a little bit about, on a serious tip, the monthly cost, because when people are working, open enrollment season happens and they get to choose. They look at what health insurance plans are available for them. So now they're turning 65 and they're trying to decide between A, B, C. Okay, I know I'm going to get A and I'm going to get B, and I might go ahead and add C or D and maybe even E, right? So generally, the out of pocket, you already told us, Cardi, so you already hit me in the face by saying $174.40 in 2024 for Medicare Part B. So that's cha-ching, all right? So I'm like, I'm going to be paying $174.40 on top of, if I get, is there a cost for a monthly premium for A, C, D, and E?
And let me add one thing to that. Just remember, you said $174 a month, right? That's about $2,000 in a year, give or take. A couple of years, $2,000 in a year. Your copay or your deductible or whatever that is when you go and you need that Medicare may eat that up in the first hour. But go ahead.
Yeah, absolutely. Like when we look at the costs, it can be significant, but it's all based on how you structure it. So let's just say you go the first route where you go original Medicare and a Medicare supplement, right? Mm-hmm. So you're going to have original Medicare. Your Part A, you've already paid for it. Your Part B, like you mentioned, $174.40. Then you're going to have that Medicare supplement plan, assuming you pick the most benefit rich out of the 10 modernized choices. Let's just say you go with Plan G. That's going to typically be the higher cost plan. And, that's going to have a premium depending. It could be close to $200. It could be over $200 depending on your depending on your age range, and then to be in compliance with prescription drug coverage, you would need to pick up a standalone prescription drug. So that Medicare supplement route, you have three major costs you have to keep in mind. You have your Part B premium, you have the premium for the supplement, and then you have a premium for the standalone prescription drug plan. Medicare Advantage, why it's one of the fastest growing Medicare health plan sectors, is, typically you only have to pay for that Medicare Part B premium. And then majority of Medicare Advantage plans will come at a $0 monthly premium, which also in many times can include your prescription drug coverage, along with other extra services like the fitness, the dental, the hearing, those type of services that go above and beyond what original Medicare is offering. So, just depending, if you're going to the doctor three times a week, right, it's going to be expensive in co-payments for you. Then you might have to look at a supplement route.
So
like most consumers, that's maybe just touching.
Yeah, bottom line, if you haven't learned from tonight, call one of these guys. Because if you're like me, I must admit, though, thank you, Earl and Cardi, I must admit, I actually feel smarter now than I did at the onset of this show. So both of you did a great job of really helping to explain in layman's terms. And I am a 36-year public health worker, and you would think I would have it, right? But thank you all so much. Thank you all so much for joining us.
Before we think, I know we're getting short of time, but the one thing we didn't cover was the Medicare enrollment period. I don't think we covered when the time for enrollment is and special enrollment period.
Okay, I guess I can. I'll go over the enrollment, the regular enrollment, and Alexis, if you want to go over the special enrollment period. Does that work? Okay. So right now, we're in what you call annual enrollment period for Medicare and the Medicare Advantage plans. Is from October 15th to December 7th. So even if you're not turning 65, now is the time where you can start looking at different plans. If you're in the Medicare Advantage plan and want to switch, you can do that at this time until December 7th. Now, open enrollment period is going to start January 1. That's going to go into March 31st. So that's another period in when you can look at potentially switching plans, but you cannot enroll in a Medicare Advantage plan during that time. You could.
So you limit it, is what you're telling me. You limit it between October and December. You can do whatever.
Yes.
In terms of enrollment.
Yeah.
But once you get past that enrollment period of December, I think it said 7. Once you get past that, come January, the special qualifications for it is
you can switch your Medicare Advantage plans, but if you didn't enroll in a Medicare Advantage in the during this period that we're in right now, then you can't do it in the spring. You'll have to wait until October next year.
Gotcha.
Okay.
That's what I wanted to clarify.
Cardi, did you want to add anything?
Yes, just outside of those times that Mr. Earl mentioned of the AEP and the OEP, right? There's what they call SEP, which is special election periods. It's
AEP, annual enrollment plan, OEP.
Oh yeah, and AEP is annual enrollment period.
Okay.
OEP is open enrollment period.
Okay, all right, just making sure.
Yes, sir. And then special election periods, which is SEP, and that's a limited number of circumstances that would allow you to enroll into a Medicare Advantage or a prescription drug plan. So like if you move from one county to another, it would open up an SEP. There's disasters like FEMA disasters. There is if you leave your employer health plan voluntarily or involuntarily. If you have if you have Medicaid or receive help for prescription drugs. So there's a list of them that we would know as brokers to check if you're outside of those periods. So even if you miss AEP, you're not limited.
So if I'm working right now and I am in the qualified coverage, and then if I stop working, say June of next year, is that a special circumstance that I can then enroll?
Yes, ma'am.
Okay.
And Earl, I think, wanted to add on to it too.
Oh, Earl, we can't hear you.
Oh, sorry. So there's what we probably didn't mention the star rating system. Plans, every Medicare Advantage plan, not original Medicare or supplements. Medicare Advantage plans have star ratings. So if there's a 5-star plan in your area, you could qualify for a special enrollment period to get in that 5-star plan.
So also one last point that I wanted to bring up, because I've heard people talking about the Medicare donut hole. When I think of donut holes, I think of Dunkin' Donuts, but that's probably not what you all are talking about. What's the Medicare donut hole? Go ahead, Cardi.
Oh, okay. So it's the donut hole has to do with your prescription drug coverage. So essentially, once you hit, I forgot the exact number. I think it's $4,660. Maybe someone can help me get that exact number. Then you get into the donut hole. So yeah, it's for 2024, it's $5,030 of the retail cost of your drugs. So that essentially means if you are going to take a drug, let's just say the drug is $100 retail cost, but you only pay $20, that $100 will be deducted from that $5,030. Once you've exhausted $5,030 in retail cost of drugs, then you're in that donut hole. And I believe that you're in that donut hole, which is commonly called the coverage gap, where you would be responsible for 25% of the cost of your prescription drugs until you reached another level of, I believe it would be, in 2023, it was 7,400. I don't know what that new number for 2024 is, but it could get very expensive depending on which drugs that you take. But, rest assured, if you qualify, there are programs out there like Extra Help, Limited Income Subsidy, that can help, cover the cost of your prescription drugs. So if you reach out to Earl or myself, we can tell you more about that in detail.
And even that goes up to a certain point, and then you get out of that donut hole, and Medicare kicks back in, right?
Yes. So when you reach that limit of true out-of-pocket costs, I forgot what that exact number is, and I apologize for that. But when you get to that threshold, then your costs are significantly reduced.
I believe it's 8,000.
8,000? Yeah, that's a lot of money to have out of your pocket.
Out of pocket.
Yeah, between 5,000, that's almost $3,000. When you think about the 5,000, well, you say it's 4,000 or something now. So it sounds like that Part E is a supplemental plan, Medigap or whatever it is or some other standalone. And by the way, Cardi, when you mentioned a standalone plan for a prescription drug, you threw me again, because I'm like, is that Part D or is that really a standalone plan? So, I although I feel a little bit more empowered, I still leave confused.
Well,
sorry about that.
I'm sorry.
I was just going to say, go ahead, Dr. King.
No, you go ahead.
Okay, well, I was just going to say, Jocelyn, for just to try to simplify a little bit, if you just on original Medicare, you have to get a standalone Part D, because original Medicare will not come with prescription coverage.
Gotcha.
Now, if you get a Part C, if you get a Medicare Advantage plan, 9 times out of 10 it's going to have Part D included. It's going to have prescription drug coverage included.
Okay, thank you.
The only other thing I was going to add was part of that is going to be phased out. That donut hole will be phased out. And is it 2026? I can't remember.
I need to look it up. I'm not too sure at the moment.
It was supposed to be by the end of by the end of this decade, essentially. Every year they've been trimming down that percentage of the donut hole, and and that's due to certain laws that President Obama had passed.
Healthcare reform.
Yes.
Right. And I'm going to go with one last thing, and before I have to throw this in, because I got to throw it in. One of the reasons Medicare got to 20%, because back in when Medicare was first proposed, back in not Teddy, which was the Franklin D. Roosevelt. He was the last Roosevelt, right? When he reproposes, his brother, or whomever, Teddy Roosevelt, proposed a universal health care plan early in the early.
I just learned something. I didn't know they were brothers, but I digress.
Okay, I think they are, but anyway, it's still a Roosevelt plan. The original one was that they were going to do a universal coverage. That didn't go very far with the first guy, Teddy. The second guy, Franklin, came along. He wanted to do Medicare. One of the reasons we have that 20% deductible is because many of the people in Congress, many of the non-minority individuals did not like the idea that African Americans could get 100% coverage for their health. So in order to keep to make them not likely they wanted all of us to die off. Now this is just historical Black history fact. They wanted us to die off. So they said, and because that was a doctrine that was proposed by someone, very racist individual. I won't get into the whole detail, but we may put it on the website. There was a doctrine that proposed that, hey, let's add 20%, which Black folks can't afford, then they'll still die off because of lack of good health care. And that's where the 20% come in at. I mean, it's astounding to believe that people can be that evil, that mean, that racist, to add 20% of your healthcare costs to your ability or inability to pay, simply because they want you to die off.
And another Black history moment by Dr.
Another
King.
Black history moment.
Thank you, Dr. King.
So tonight has been very informative for those of you who are, maybe you're not 65 or nearing 65, but if you have a parent or someone you care about, we hope that you learned a lot from our guests, because that is that's what we try to do here on Pause for the Truth. We try to leave you with some more knowledge than you had before you joined the show. So I hope you were not turned off when I said Medicare and you're like, oh God, I'm not 65, I'm 49, but you may have a loved one and you want to be there for them. At the end of every show, we like to give our guests an opportunity to share their final thoughts for tonight regarding the discussion. And in your comments, please make sure that you can either state your phone number or your website or email address for people to reach out to you. And I'll start with Insured by Earl. Go ahead, Earl.
State whatever you want to along that line.
Okay. Well, I just want to say thank y'all for having me on. I appreciate it. This is my second time joining. I think it was last year or the year before that I was on. So Dr. Kane Jocelyn, thank you. And Cardi, it's just always a pleasure. I think you were on the first time I was on. Right. Okay. So I just want to say I appreciate it. And if anybody wants to reach out, you can reach me at 904-556-0156. My website is earlsymmetry.com. And my email is earljonesjr@outlook.com. So feel free to, write it down and reach out even if you got any questions about what the current plan is, what this plan does. I also do life insurance and health insurance as well. So feel free to reach out.
Because you're a broker and you can do it all, right?
Precisely.
Well, not auto insurance, huh? But anyway, I digress. No auto insurance.
Not yet.
Your physical health. So, and I say that because, oh my God, insurance is so expensive. Thank you, Earl. Again, thank you for joining us again. And I'm sure this time next year, for those persons who were born in 1960, we got you. We'll be back this time next year. Cardi Alexis. I love that name. That sounds like a celebrity name, doesn't it? Go ahead, Cardi. What are your final thoughts for tonight?
Well, I wanted to thank you very much, Ms. Jocelyn. And thank you, Dr. Kane, for the opportunity to be on here. Once again, thanks for all the listeners. We hope that you during this annual enrollment period to make an informed decision on your Medicare health plans. This is extremely, extremely important, not only for your pocketbooks, but for your peace of mind. And if you know someone that's Medicare aged, just check in with them, make sure that they were able to make an informed decision here before the 7th of December. If you do have any questions, obviously you could call Mr. Earl or myself. My direct cell phone is 813-590-8023. My website is www.affordinsure.com. That's AFFORDINSURE.com. You can browse it for more information. And then I have a page that's called Health Insurance for All, where you can choose your age bracket, whether it's 0 to 64 or 65 and older, and be able to get, online quotes or even sign yourselves up for a health plan. It all comes back to me. And if you have questions, you're more than welcome to reach out to me directly. Thank you. And God bless if you believe.
Thank you. It's been very informative. Dr. Kane, you always have enlightened, you've given us a Black History moment. What are your final thoughts regarding tonight's topic? And I really say that on a serious tip as a primary care provider. And I know you're not a broker, but you sure help folks, help guide them on which plan to sign up for.
Let me first say thank you guys. I love these guys because they come on, they give their honest opinion, and we'll do the same thing as far as if they want to sign up. As far as the individual is concerned, I think what they represent is them on this show is themselves that they would represent in private, to try to look at the best route from whomever their client will be and what fits them best. All they need is your help to make sure that they choose the right plan, because they got to know what your concerns are, what it is that you would like to have in terms of insurability, and then try to meet your needs, okay, and your desires, to try to join them for the best insurance plan for you. The other thing I like to say is that I'm very limited, believe it or not. By law, I am limited with being able to recommend anybody to a particular insurance plan. So when a patient asks me, which insurance plans you want, Dr. Kane, I'm going like, look, I can't tell you that. That's against Medicare. Medicare would fry me. They stick me in a skewer and just roast me from one side to the other if I did such a thing. So the first thing I do is say, here's a couple of insurance brokers, call them and make a decision for yourself, because I got a list of guys that I use, and that these gentlemen are very knowledgeable with what you would need, you as the patient, as the consumer. Patient and consumer can be two different things depending on what umbrella you're trying to define. But you as a consumer / patient will get the best advice that can be given, and that is the best advice that can be given is an honest advice, honest opinion in terms of what they know or don't know. When patients come to see me, they ask me something above my grade level. It's like, I don't know, but I will find somebody who do. And I believe both of these gentlemen are just like that. If they don't know, based on what they were discussing this evening, I do truly believe that they will find the answer for you.
Thank you, Dr. Kane. Thank you, Dr. Kane. And again, thank you, Cardi Alexis and Earl Jones Jr. Again, folks, if you are confused or if you just simply have questions, I think both of these gentlemen can help you out, can help guide you. And as they said, if you haven't gotten it from it, we're not talking down about any Medicare Advantage plan. We're simply letting you know sometimes talking to an independent person is a better route for you, because you're not stuck in that particular plan, or that individual will not just talk about what their company offers. These guys will come to you from what your particular needs are. And by the way, one thing that Cardi said And I learned this, by the way, from my dad when his health started failing. Put a few extra dollars away and do yourself a favor and buy a long-term care plan. You won't regret it. As always, thank you for tuning in to Pause for the Truth. And look like Dr. Kane, he can never Cardi and Earl. He can never just say good night. What is it now, Dr. Kane?
No, I was just saying buy a good plan. You got to be careful with the long-term care plan you have. A company that is survivable, I think that's viable. You got to see what benefits they play, because that's even in itself is a whole nother discussion.
Well, that's why you talk to independent broker who can help guide you. So again, thank you to our viewers. And I'd really like to say a special thank you. We have a core group of people who they'll text or Dr. Kane, myself, or Tyrone afterwards and say they really enjoy the show week after week after week. You know who you are. Thank you. And please, if you know your loved ones need this information and they missed it, it will be available on YouTube. Subscribe to our YouTube channel. Go on our website. Share tonight's podcast with them, because the more we know, the better we're able to make an informed decision. Thank you, and tune in next week for Pause for the Truth. Good night.
Get an ugly picture off of that.
Welcome to Pause for the Truth. We are grateful that you joined us today and hope you've gained valuable insights on our current topic. We look forward to having you with us next time as we explore trending issues in our community and discover ways to simplify life for you and your loved ones. Our dedicated panelists and staff are committed to sharing knowledge and serving our community. But now, we need your support. Please subscribe to our YouTube channel and spread this valuable knowledge to others. Don't forget to invite your family and friends to tune in to our podcast every Tuesday at 6:30 p.m. EST. Visit our website at www.pauseforthetruth.com and show your support by liking us on Facebook, following us on Twitter, and linking with us on LinkedIn. Feel free to email us with any questions or concerns, or show topic recommendations at info@pauseforthetruth.com. I would also like to give thanks to our behind-the-scenes technology engineer, Tyrone Jackson, owner and operator of Call Tyrone. Go to www.calltyrone.net for a complete list of services. Thank you for being a part of Pause for the Truth. Together, we can make a positive impact on our community. Good night.